Now, it is now my great pleasure to yield to my colleague and friend Lois Capps from California, who came to Congress, the same 106th Congress, I believe, along with me, prior to that being a nurse, and is now retiring from that seat. But not before she adds one more thing at least, maybe there'll be more, to making our health system better and protecting so many lives. So I yield to you as much time as you may consume.
Gentlelady from California is recognized.
I thank my dear colleague from Illinois for yielding me the time. And Mr. Speaker, I rise in strong support of H.R. 1209, the Improving Access to Maternity Care Act, which I'm proud to have co-authored with my colleague from Texas, Congressman Burgess. We know that healthy women make healthy moms. Healthy moms make healthy babies. To support these women throughout their lives, they need access to preconception, prenatal, postpartum, and interpartum care, interpartum being that time between one child and the next, should there be another child. But too many communities lack the skilled maternity care professionals who are able to provide these services, and that's what this bill would address. H.R. 1209 would harness the power of the National Health Service Corps to better target maternity health care to the communities that need this care the most. Maternity care professionals are already included in the program and doing great work in communities across the country. But at present, these providers' placement is based on data related to primary care access shortage without regard to the specific maternity care which may be needed. So while they are doing important work, there is more that we can and we should do to ensure that they reach the areas that would benefit most from high-quality maternity care. Our bill would start this process and ensure that the National Health Service Corps takes steps to use data to help more accurately place maternity care professionals in the locations that have the greatest need. H.R. 1209 would set up a process to identify communities in existing health professional shortage areas that most need maternity care. And then it would require action to get maternity care professionals into these targeted areas. We know that the National Health Service Corps is one of our most effective programs which improves access to care in underserved areas. We just want to make sure that we don't leave any community behind, especially when it comes to the health of mothers and their babies. So I want to again thank my colleague, Dr. Burgess, for partnering with me on this legislation. I thank Chairman Upton and Ranking Member Pallone and their staff and all the staff for helping us move this bill forward. And I have a staff, Deputy Chief of Staff and Health Policy Advisor, Adrienne Caselotti. I want to thank her for her years of work on this legislation. And with that, I urge the full support of this legislation. I yield back.